Don't miss these 8 early cancer signs. It could save you. Did you know every 60 seconds, cancer changes someone's life forever? But here's the shocking truth: 40% of cancers could be prevented with early detection. Even more startling? Most people miss the critical early cancer signs that could save their lives. When cancer is caught in stage 1, survival rates rocket past 90%. Wait too long, and those chances drop to just 20%. These aren't just numbers, they're lives that could be saved through early cancer detection. Here's what sets this vital information apart. While everyone knows the obvious cancer symptoms, your body actually sends out early warning signals weeks, months, or even years before. These subtle signs of cancer are like whispers from your body, but most people simply don't recognize them. Today, we're breaking down 8 early signs that cancer is growing in your body, signs that most medical websites won't tell you about. This isn't about random internet theories or health myths. Every single sign we'll discuss is backed by serious cancer research and has helped countless people catch cancer at its most treatable stage. Think of these cancer warning signs as your body's natural alert signals. By learning to recognize these early cancer signs, you're not just gaining knowledge, you're gaining power over your health. This information has already helped thousands of people with early cancer detection, and it could do the same for you or someone you love. Let's explore these vital early warning signs together, and remember, knowledge truly is power when it comes to protecting your health. 1. Bone pain. Bone pain stands out as one of the earliest warning signals your body sends when cancer develops. This isn't just any ordinary pain, it's a specific type of discomfort that could signal the presence of cancer cells affecting your bone tissue. Understanding this particular early cancer sign could make a critical difference in early cancer detection. Let's focus on exactly what to watch for. When cancer impacts your bones, you'll notice several distinct symptoms. First, the pain feels deep and penetrating, completely different from muscle soreness or exercise strain. It typically starts in one specific spot and doesn't go away with rest or pain medication. This type of bone discomfort often becomes your body's first alert system. Key warning signals include intense nighttime pain while you're trying to sleep, constant deep aching that seems to come from inside your bones, and discomfort that gradually becomes more severe over weeks or months instead of getting better. Most notably, this pain often affects the long bones in your arms and legs, creating a persistent throbbing sensation that's hard to ignore. Watch for these additional signs: unexpected tenderness in specific bone areas, swelling around the painful spot, and increasing difficulty with normal movements. Some people notice the pain is particularly intense in the early morning or when trying to use the affected area. Unlike typical bone injuries that improve with time, this discomfort follows a pattern of steady intensification. What makes bone pain a critical early cancer sign is its persistence and progression. While occasional aches are common, especially after physical activity, cancer-related bone pain typically doesn't fade away. Instead, it often follows a pattern of steady intensification, particularly during rest periods. This distinct pattern separates it from normal aches and pains, making it an essential signal to recognize. 2. Eye pain. Eye changes and discomfort can signal early cancer development, particularly ocular melanoma, the most common eye cancer. Understanding these specific visual warning signs could lead to crucial early cancer detection before symptoms become severe. Your eyes send clear signals when something's wrong. Watch for these distinct changes: sudden blurred vision that doesn't improve with new glasses, unexplained dark spots in your field of vision, or flashing lights that aren't related to migraines. These symptoms often start subtly but progressively worsen over time. The most critical warning sign appears as a new dark spot on your iris, the colored part of your eye. This spot typically starts small but gradually changes in size or color. Pay special attention if you notice your iris developing an unusual dark patch, especially if it grows or changes shape. Some people also experience a sensation of pressure or discomfort that doesn't go away with normal eye drops or rest. Additional warning signals include seeing shadows or floating spots that persist, particularly if they appear in just one eye. Watch for unexplained light sensitivity or pain that feels different from typical eye strain. A change in the way your eye looks, like one eye protruding slightly more than the other or a pupil that stays dilated, demands immediate attention. Light-colored eyes and fair skin increase susceptibility to this type of cancer, making these symptoms even more significant for people with these characteristics. The key difference between normal eye problems and potential cancer signs lies in their persistence and progression. While common eye issues often resolve with rest or treatment, these cancer-related changes typically continue to develop and worsen over time. 3. Body rashes. Body rashes linked to cancer, particularly leukemia, appear distinctly different from common skin irritations. These unique skin changes serve as early warning signals that could indicate serious underlying conditions requiring early cancer detection. The most telling sign is the appearance of petechiae, tiny round spots that mark your skin in an unusual pattern. These spots measure about 1 to 2 millimeters across and show up in colors ranging from red to purple or brown. Unlike normal rashes, these spots don't fade when you press on them, and they often cluster together in specific areas of your body. Watch for these distinctive characteristics. The spots typically appear in places where pressure occurs, such as your ankles, waist, or areas where clothing fits tightly. These spots emerge because of low platelet counts, creating a unique pattern that differs significantly from common rashes or allergic reactions. Key warning signals include spots that appear suddenly without any apparent cause, don't itch like typical rashes, and don't respond to usual skin treatments. You might notice them clustering more prominently after standing for long periods or wearing tight clothing. The spots often multiply over time rather than fading away like normal rashes. Additional red flags include finding these spots accompanied by unexplained bruising that appears too easily or bleeding that takes longer than usual to stop. Unlike standard rashes that might come and go, these spots tend to persist and gradually increase in number. The pattern often starts subtly but becomes more noticeable as days pass, particularly on paler skin areas. 4. Fingernail marks. Fingernail changes can reveal early signs of cancer, particularly subungual melanoma, a serious form of skin cancer that develops under your nails. These distinctive nail changes often appear before other symptoms, making them crucial indicators for early cancer detection. The most significant warning sign is a dark vertical stripe suddenly appearing on your nail, medically known as melanonicia striata. This isn't like typical nail bruising or discoloration. The stripe runs from the base to the tip of your nail, often starting on your thumb or big toe, though it can appear on any nail. Watch for these specific characteristics. The dark streak typically measures wider than 3 millimeters, shows varying shades of brown or black within the same stripe, and may have blurred or irregular borders. Pay particular attention if the pigmentation extends onto the skin surrounding your nail, a critical indicator known as Hutchinson sign. Key warning signals include changes in an existing streak, such as the stripe becomes wider or darker over time, developing irregular coloring within the streak, or new pigmented bands appearing on other nails. Unlike nail fungus or bruising, these changes don't grow out or fade with time, but instead become more pronounced. Other concerning indicators include nail damage that doesn't heal, splitting or bleeding of the affected nail, or pain in the nail bed without any injury. The affected nail might also separate from the nail bed or develop unusual thickening. These changes typically affect one nail predominantly, rather than all nails simultaneously like most common nail conditions. 5. Night sweat. Night sweats as a potential cancer sign, especially in lymphoma, appear with distinct and severe characteristics. You'll experience complete soaking of your night clothes and bedding, not just mild dampness, but thorough drenching that forces you to change everything in the middle of the night. The intensity sets these sweats apart from normal perspiration. Your entire body will be drenched in sweat, with your clothes and bedding becoming completely wet. These episodes typically hit during sleep hours and follow a clear pattern: sudden awakening with soaked bedding, followed by intense chills, requiring immediate clothing and sheet changes. The sweating is severe enough to drench sleepwear and sheets completely, occurring consistently night after night. Unlike normal sweating, this affects your whole body rather than just certain areas, and happens regardless of room temperature, often requiring multiple bedding changes nightly. The sweating episodes come with dramatic temperature shifts, swinging from intense heat to sudden cold. What makes these night sweats particularly significant is their appearance alongside other changes: unexpected weight loss without dieting, mild fever that comes and goes, and unusual tiredness during the day. The sweating persists despite environmental adjustments like lowering room temperature or using lighter bedding. The crucial difference lies in consistency and severity. While normal night sweats might occur occasionally from environmental factors or stress, cancer-related night sweats maintain their intensity and frequency regardless of external conditions. They continue night after night, creating a persistent pattern that doesn't improve with typical remedies or lifestyle changes. This unrelenting pattern distinguishes them from ordinary nighttime perspiration. 6. Persistent heartburn. Persistent heartburn goes beyond occasional acid reflux after spicy meals. When heartburn becomes a frequent unwanted companion, particularly if it continues or worsens despite using over-the-counter medications, it might signal esophageal cancer. This isn't your typical burning sensation that comes and goes, it's a persistent discomfort that demands attention. The key distinction lies in how this heartburn behaves. Unlike regular acid reflux that might flare up after certain foods or when lying down, cancer-related heartburn persists regardless of what you eat or how you position yourself. You might notice the burning sensation becoming more intense or frequent over time, creating a consistent pattern of discomfort that medications don't seem to touch. Pay particular attention if swallowing becomes increasingly difficult. Food might feel like it's sticking in your throat or chest, and you might need to drink more liquids to help food go down. This trouble with swallowing often starts subtly with solid foods and gradually affects softer foods too. Some people notice themselves automatically eating slower or choosing softer foods to cope with the discomfort. The burning sensation typically appears in your chest area and might spread upward toward your throat. Unlike occasional heartburn that strikes after meals, this discomfort often lingers between meals and might even wake you from sleep. You might also notice your voice becoming hoarse, especially in the morning, or experience a persistent cough that doesn't go away. These symptoms tend to worsen over time rather than improve with standard heartburn remedies. 7. Jaundice. Jaundice appears as a distinctive yellowing of your skin and the whites of your eyes, potentially signaling pancreatic or liver cancer. This yellowing begins subtly but progressively becomes more noticeable, creating a color change that's impossible to miss. Unlike temporary yellowish tints from certain foods or medications, cancer-related jaundice continues to intensify over time. The color change typically starts in your eyes, specifically in the whites, before spreading to your skin. You might notice this yellowing first in natural lighting, particularly when looking in the mirror during daylight hours. As it progresses, the yellow tint becomes more apparent across your entire body, though it often appears more prominently in certain areas like your face, chest, and palms. Along with the yellowing, your body sends other clear signals. Your urine might become unusually dark, taking on a cola or tea-like color, while your stools become lighter, sometimes appearing clay-colored or pale. These color changes happen because bile isn't flowing properly through your system. You might also notice itching across your skin that doesn't improve with typical anti-itch treatments. The progression of these symptoms follows a distinct pattern. The yellowing typically starts gradually but steadily intensifies. You might also experience upper abdominal discomfort or pain, particularly on your right side. Some people notice unexplained weight loss or a decrease in appetite accompanying these changes. Unlike temporary yellowing from other causes, cancer-related jaundice persists and typically becomes more pronounced despite lifestyle changes or standard treatments. 8. Fever. Fever linked to cancer, particularly blood cancers like leukemia and lymphoma, presents unique patterns that set it apart from common illnesses. Unlike typical fevers that resolve within days, cancer-related fevers persist or return regularly without any obvious infection. These temperature elevations follow specific patterns that your body uses as warning signals. The fever typically appears in cycles, creating a distinctive pattern of temperature spikes and drops. You might notice your temperature rising at similar times each day or every few days, even when you're feeling otherwise well. What makes these fevers significant isn't their intensity, but rather their unexplained recurrence and persistent pattern when no infection is present. The fever episodes come with their own set of companions. During temperature spikes, you might experience sudden sweating, followed by chills once the fever breaks. Unlike regular fevers from infections, these episodes continue even when treated with standard fever-reducing medications. They often appear alongside unusual fatigue that doesn't improve with rest and may occur with unexplained weight loss. What distinguishes these cancer-related fevers is their cyclical nature and resistance to normal treatments. While regular fevers typically respond to medication and rest, these fevers maintain their pattern regardless of standard interventions. You might feel relatively normal between episodes, only to have the fever return like clockwork. This persistent cycle, especially when accompanied by night sweats, unexplained fatigue, or easy bruising, creates a pattern distinct from common illnesses. Understanding these 8 early cancer signs could mean the difference between early detection and late diagnosis. Your body speaks to you every day, through your bones, skin, eyes, and even your sleep patterns. When you recognize these signals early, you gain precious time and significantly better treatment options. Remember, these warning signs don't automatically mean cancer, but they deserve your attention. Early cancer detection dramatically improves survival rates, from finding skin cancer early to spotting the first signs that cancer is growing in your body. Don't wait for obvious symptoms to appear. Pay attention to these subtle yet significant changes in your body. Share this valuable health information to those close to you. Because when it comes to cancer, early detection isn't just important, it's everything. Thanks for watching. Don't forget to subscribe, like, and comment down below which seeds you have tried.